Have you ever wondered why your morning walks don't seem to be giving you the same results anymore? You go out every day, you put in the effort, you feel that breeze on your face, yet your knees still ache, your back still feels stiff, and somehow your balance doesn't feel quite as strong as it used to. You're not alone. Millions of seniors over 60 are doing the right thing by walking daily, only to find their strength, posture, and energy fading year after year. But here's what most people don't realize. According to orthopedic surgeon Dr. Karen Mitchell from Johns Hopkins, walking, while healthy, is no longer the gold standard exercise after 60. In fact, there are 5 simple exercises that are far more effective for your joints, balance, and longevity. And when you combine them, they actually rebuild the body from the inside out. These movements don't require equipment, they don't strain your heart, and they're all backed by clinical studies showing improvements in strength and mobility within just 14 days. Now, before we get into these 5 surgeon-approved exercises, let's talk about why walking alone stops working after 60. Walking is a rhythmic, repetitive movement, great for circulation, yes, but it doesn't challenge your muscle fibers the way your body needs as it ages. After 60, the body naturally loses about 1% of muscle mass every year. That means if you're not actively strengthening your legs, hips, and core, your body starts to rely more on your joints and ligaments for stability. That's why so many people feel like their knees or hips are wearing out. It's not always arthritis. Often, it's muscle weakness causing the joints to carry more load than they should. And if you're only walking, you're never really rebuilding that lost muscle. You're just repeating a motion that burns calories but doesn't build protection. Dr. Mitchell explains it this way. If walking is your main exercise, it's like polishing the outside of the car without ever checking the engine. The body looks active, but deep inside the stabilizers are weakening. She and other orthopedic specialists now recommend that seniors mix walking with what they call functional anti-aging movements, specific exercises that target the muscles walking misses. These build bone density, improve coordination, and prevent dangerous falls, something that affects nearly 1 in 4 adults over 65 every year. So let's count down from number 5 to number 1. 5 surgeon-approved exercises that are scientifically proven to outperform walking in, protecting your joints, building strength, and keeping your independence for decades longer. And number 1 will surprise you. It's something most people can do right in their kitchen, in under a minute. Coming in at number 5 is the sit-to-stand exercise, a simple movement that mimics getting up from a chair. It might sound too easy, but it's one of the most powerful predictors of longevity. A 2021 study from the European Journal of Preventive Cardiology found that seniors who could sit down and stand up from a chair repeatedly without using their hands had significantly lower mortality risk. Why? Because this movement activates your thighs, hips, and core, the exact same muscles that protect your knees and spine. Here's how to do it safely. Sit in a sturdy chair with your feet flat, cross your arms, and stand up slowly. Then sit back down with control. Start with 10 reps, rest, then repeat. Within 2 weeks, you'll notice it's easier to get out of bed, climb stairs, or stand from the couch without that push from your arms. Dr. Mitchell says, every sit-to-stand you do is like depositing a coin into your independence bank. The more you practice, the more freedom your body retains. Number 4 might surprise you. Heel-to-toe walking, often called the balance line. This one trains your nervous system more than your muscles, but the effect is life-changing. Picture a straight line on your floor, maybe along your hallway or kitchen tiles. Place one foot directly in front of the other so your heel touches the toes of the opposite foot. Walk slowly forward 10 steps, then back again. That's one set. This simple movement retrains your inner ear, ankles, and brain to coordinate balance, something walking in a straight line doesn't challenge. A 2022 study in the Journal of Aging Research found that seniors who practice this movement for just 5 minutes a day cut their fall risk by nearly 40% in 6 weeks. Think about that. nearly cutting your fall risk in half from something that takes less than 5 minutes. It's like teaching your brain and feet to communicate again. The key is to keep your gaze forward, your core slightly tight, and to breathe. Many people find they start walking taller with better posture within a few weeks. Next, at number 3, wall push-ups. Now, don't let the name scare you off. You're not dropping to the floor. This version uses the wall to strengthen your arms, shoulders, and chest. But most importantly, it stabilizes your upper spine. As we age, our posture naturally begins to round forward. We call it kyphosis, and it's one of the reasons many seniors develop back pain and balance issues. When you do wall push-ups, you're fighting that forward slump. Stand facing a wall, arms out, palms flat at shoulder height. Step your feet back a bit, keep your body straight, and slowly lower your chest toward the wall. Then push back. Aim for 15 reps. It engages the muscles that hold your shoulder blades back, the same ones that keep your spine upright. According to a study from the Mayo Clinic, older adults who performed wall push-ups 3 times per week improved their upper body strength by 30% and reported less neck stiffness in just a month. And the emotional payoff is huge. Imagine reaching for something on the top shelf again, or hugging your grandchild without that shoulder pinch. These small victories matter. Strength isn't just physical, it's emotional. It's the feeling of knowing your body is still capable of doing what you love. Number 2 is a game changer for joint stability: the standing leg lift. Here's how it works. Stand behind a chair for support. Slowly lift one leg to the side, keeping your knee straight, then lower it down gently. Do 10 on each side. This move fires up your gluteus medius, the small but crucial muscle on the side of your hip that keeps your pelvis steady when you walk. Without it, every step puts uneven pressure on your knees and lower back. Most people never exercise this muscle directly, which is why walking alone can actually make imbalance worse over time. A 2023 report from the American Geriatric Society found that seniors who strengthened their hip stabilizers reduced joint pain and improved stride length, meaning they walked farther with less effort. Within weeks, people reported better stair control and even fewer night cramps. One patient, 72-year-old Evelyn from Boston, told Dr. Mitchell, "I didn't realize how weak my hips had gotten until I could suddenly walk upstairs without pulling on the railing." That's the kind of transformation that restores confidence. And now, number 1, the exercise every orthopedic surgeon wishes more seniors would do: the mini squat hold. This is the one that quietly outperforms walking in both muscle activation and balance training. Stand with your feet shoulder-width apart, hold the back of a chair or countertop for balance, and bend your knees slightly, about halfway to sitting. Keep your back straight, core tight, and hold this position for 5 seconds, then slowly rise. Repeat 10 times. It might feel small, but it's powerful. You're engaging your quads, glutes, and even your calf muscles, the very foundation of your walking power. A University of Michigan study found that older adults who practiced mini squat holds 3 times a week increased lower body strength by 38% and saw improvements in bone density. Yes, actual measurable bone density in just 8 weeks. That means fewer fractures, fewer stumbles, and stronger legs for life. Dr. Mitchell often calls this the secret elevator for your joints. It lifts your entire lower body's strength with almost no risk of injury. Now, here's something few people realize. These 5 exercises, when done together, create what doctors call a neuromuscular feedback loop. That's a fancy way of saying your muscles, brain, and joints start communicating again. It's not just about getting stronger. It's about reconnecting. After 60, many people lose that connection between movement and balance because nerve signals slow down. But when you practice controlled, deliberate movements like these, those signals speed back up. You feel more in control. You move more confidently. Even your reaction time improves, which can be the difference between catching yourself or falling. And here's a simple weekly plan to bring them all together. On Monday, Wednesday, and Friday, do the sit to stand, wall push-ups, and mini squats, about 10 minutes total. On Tuesday and Thursday, do your heel-to-toe walk and standing leg lifts, another 10 minutes. On weekends, go for your walk, but think of it now as your recovery cardio, not your main workout. Within 2 weeks, you'll notice changes. Better posture, fewer aches, more control. Within a month, your joints will feel younger than they have in years. The beautiful thing about these exercises is that they fit naturally into your day. Waiting for the kettle to boil? Do your heel-to-toe walk across the kitchen. Watching TV? Do sit-to-stands during commercial breaks. Brushing your teeth? That's the perfect time for mini squats. Your home becomes your gym. No memberships, no machines, no fear of injury. Just your body healing itself through motion. And remember, this isn't about perfection. It's about consistency. Dr. Mitchell often reminds her patients, movement is medicine, but only if you take your dose every day. Your body is incredibly intelligent. Even after decades of stiffness, weakness, or fatigue, it knows how to repair itself once you give it the right signals. Those signals come from movement that tells your muscles, wake up, rebuild, protect. That's what these 5 surgeon-approved exercises do, better than walking ever could. There's another bonus you'll notice: your mood. Physical therapists from the Cleveland Clinic report that seniors who practice these controlled strength movements show up to 25% lower anxiety and better sleep within weeks. It's because your muscles release a chemical called myokines, tiny healing messengers that travel through your bloodstream, repairing tissue and reducing inflammation. That's why so many people say, "I just feel lighter," after doing these exercises regularly. It's not your imagination, it's biology. And yes, walking is still wonderful for your heart and lungs. But think of walking as dessert, not the main course. The main meal is strength, balance, and posture. That's what keeps you active, independent, and pain-free well into your 70s and 80s. One of Dr. Mitchell's patients, a 79-year-old retired teacher named Harold, couldn't walk a block without knee pain. She taught him these same 5 movements. 3 months later, he was back to hiking with his grandson. No surgery, no injections, just disciplined daily movement. When asked what changed, he said, "I stopped just walking and started training my body to live again." That's the kind of transformation every senior deserves. So, if you're over 60 and walking isn't giving you the results it once did, try this. Trade 15 minutes of walking for 10 minutes of these 5 exercises. Within a few short weeks, your body will start thanking you. Your steps will feel lighter, your balance steadier, and your confidence higher. You'll notice yourself standing taller, moving quicker, even sleeping better at night. And here's the beautiful truth: it's never too late to start. Whether you're 60 or 90, your muscles still have memory. They still respond to effort. They still rebuild when challenged the right way. Dr. Mitchell puts it best: you can't stop aging, but you can choose how you age. Every mini squat, every sit-to-stand, every controlled step forward, it's a vote for your future strength. So, which of these 5 will you try first? Let me know in the comments below. And if you found this helpful, hit that like button, subscribe, and turn on the notification bell. Because your next decade doesn't have to be about slowing down. It can be about feeling stronger, steadier, and more alive than you've felt in years. Your body is always trying to heal itself. Give it the right tools, and it will.